What if I told you that the pain in your lower back isn't just aging, but a quiet signal your body has been trying to send you for years? That little pinch when you stand up, that stiffness when you put on your socks, that ache that shows up after sitting for too long. It's not a sign of weakness. It's not just wear and tear. It's your spine adapting and now asking for help. And here's the good news. You can retrain it, you can relieve it, and you can do it with 4 simple, surgeon-approved movements that take less than a minute each. These movements reset the most overlooked joint in your lower back, the one responsible for more pain, stiffness, and imbalance than most people realize. If you're over 50 and tired of waking up in pain, stay with me. Your turning point starts right here, in the next few seconds. Don't forget to subscribe for more tips. If you're over 50 and that nagging pinch in your lower back feels all too familiar, listen up. The first thing I teach my patients is something incredibly simple, yet powerfully effective. It's called the prone elbow press, and I've seen it bring relief in less than a minute. Let me show you. Start by lying on your stomach. Just rest your forehead on the floor for a moment, and then gently press up onto your elbows. The key here is to keep your hips grounded on the floor. You're not trying to force a deep back bend or push into any pain. You are simply inviting your spine to move in a direction it has likely forgotten after years of slouching, long commutes, and working from soft couches. This is why this movement is so important. So many of my patients believe their back pain is just a normal part of aging. But in reality, it's often a result of adaptation. Your spine has adapted to the way you sit, stand, and live your life. Over time, this creates compression in the lumbosacral joint, that small but powerful joint where your spine meets your pelvis. The prone elbow press gently reverses that pressure. Within just 20 to 30 seconds, many people feel that persistent tightness start to ease. It's not because you suddenly became more flexible. It's because your spine is finally allowed to breathe again. The protective pain signals begin to quiet down. Your nervous system relaxes, and your spine remembers what a neutral, healthy alignment actually feels like. Think of it as hitting the reset button on your lower back. You're not trying to stretch your way out of pain. Instead, you're teaching your spine how to move correctly again. It's a small, gentle movement, but for many of my patients, it becomes a daily lifeline. It's a powerful reminder that your back isn't fragile. It's simply waiting for the right signal to heal. One of the biggest misconceptions I hear from older adults is this: if it hurts, I should stop moving. But when it comes to lower back pain, especially the kind that lingers after sitting or makes you feel stiff in the mornings, gentle movement is often the very medicine your spine has been waiting for. And that's exactly why this next exercise, the supine knee rotation, is so incredibly powerful. It looks simple enough. You just lie on your back, bring your knees up toward your chest, and let them slowly drift from side to side, like a calm pendulum. But the effect this has on your spine goes much, much deeper. Over the years, from long commutes, desk work, and just habitual sitting, the lower spine becomes stiff and guarded. Your nervous system senses this stiffness, and, in an attempt to protect you, it activates the surrounding muscles, creating even more tension and pain. It's a vicious cycle that can last for years. This gentle rocking movement is transformative. As you rock your knees from side to side, you're sending a crucial safety signal to your nervous system. You're telling it, it's okay to move. You are safe. This movement doesn't force rotation, it reintroduces it. It brings back a range of motion that most adults over 50 have quietly lost without even realizing it. As your knees sway, the spine begins to unwind. The deep joint receptors start sending calming signals to your brain, and those muscles that have been guarding your lower back finally begin to let go. Many of my patients describe it as feeling their back unlock for the first time in years. And here's the wonderful part. You don't need strength, flexibility, or perfect form to benefit from this. All you need is slow, gentle movement. Think of this exercise like oiling a rusty hinge. It might not fix everything in one day, but with each repetition, your spine remembers how to move freely again. If you practice this each morning or before bed, you may notice something subtle but life-changing. You wake up with less stiffness, you move with more confidence, and you stop bracing for pain because your body finally realizes it doesn't need to. When I evaluate older adults with chronic lower back pain, I often find the same hidden problem. It's not weak muscles, but silent muscles. Specifically, the deep stabilizers of the spine that the brain slowly turns off after years of pain, stiffness, and guarded movement. This is where an exercise called the bird dog with knee hover becomes one of the most powerful tools I can teach. At first glance, it looks simple. You get on your hands and knees, reach one arm straight forward, and hover the opposite knee, just an inch above the ground. But that tiny hover is what changes everything. It forces your brain to wake up the deep muscles along your spine, especially a critical one called the multifidus. Think of this muscle as your body's own natural back brace. For many people over 50, this muscle has been asleep for years. Pain causes the nervous system to shut it down as a way to protect the spine. But unfortunately, when those stabilizers go quiet, the back becomes even more vulnerable. Larger muscles try to take over, leading to tightness, overuse, and even more pain. This exercise reactivates that internal support system gently, safely, and intelligently. When you extend one arm and hover the opposite knee, your body has to stabilize itself reflexively. You're not using force, you're using coordination. This is what we call reflexive stability, the body's natural built-in ability to protect itself. And this is the exact ability that can start to fade after 50, unless we intentionally retrain it. What I love most is watching my patients feel that shift. They feel the trembling as their deep core wakes up. They sense a feeling of steady control returning to their body. And they feel surprised when they stand up afterward and realize their back feels lighter, as if it's being supported from the inside. This isn't about getting six-pack abs. It's about giving your spine back its internal bodyguards. Over time, practicing the bird dog with knee hover improves balance, walking, stability, fall prevention, and makes everyday movements, from tying your shoes to lifting groceries, feel easier and safer. You don't need to push hard. You just need precision, awareness, and calm breathing. Because the moment your deep core begins firing again, your back finally remembers how to feel safe. If there's one movement that surprises my patients the most, it's this next one, the humble standing hip circle. Most people don't realize how deeply the hips influence the lower back. In fact, when I evaluate adults over 50 with chronic stiffness, I often find the origin of their pain isn't in the spine at all, it's in the pelvis. And that's exactly why this exercise is a game changer. When you stand tall, lightly touch a wall for balance, and begin drawing slow circles with your knee or your foot, something remarkable happens. The deep stabilizing muscles of your hips, especially the gluteus medius, wake up. These muscles are small, often ignored, and absolutely essential for stability. When they weaken with age, even just a little, your pelvis begins to tip slightly with every single step you take. That slight tilt might seem harmless, but over thousands of steps, it adds up to a constant torque on your lumbosacral joint, the very same joint responsible for most over 50 back pain. When you strengthen the hips, suddenly the spine can breathe again. I tell my patients to imagine this movement as resetting their pelvic compass. The slow circles reteach your brain where your body is in space, a system called proprioception, and that system controls everything from your balance to your posture to your walking rhythm. You're not just moving your leg, you're rewiring your nervous system. As your knee circles outward, forward, and back, the stabilizers around your pelvis start firing in perfect sequence. This reduces strain on the lower back, improves your alignment, and restores a sense of control that many adults haven't felt in years. And something else happens too. People begin to feel more confident on their feet. They stand taller. They walk with less hesitation. The fear of falling, one of the biggest concerns after 60, slowly starts to fade away. What I love about this exercise is that it requires no equipment, no strength training experience, and no complicated setup. Just you, your body, and a willingness to move slowly and with intention. For many of my patients, this is the moment they realize, my pain wasn't because I was weak. It was because the right muscles weren't awake. And once those deep hip stabilizers wake up, everything begins to change. So try these simple movements. Be gentle, be consistent, and listen to your body. You might be surprised at how quickly your back begins to thank you. If you're over 50, there's something I wish every single one of my patients truly understood. You are not fragile. You are adaptive. Your spine, your muscles, your joints, they haven't been wearing out over the years. They've simply been adjusting. They've been adapting to how you've sat, how you've stood, how you've worked, and how you've moved for decades. And that's fantastic news, because it means change is not only possible, it's expected. Once you start giving your body the right signals, now, These signals don't come from punishing, intense workouts or from pushing through pain. They come from small, intelligent, consistent movements, just like the exercises we're about to go through together. I want to give you the exact same advice I give in my clinic every single week. These are the core principles that unlock lasting relief. First, and this is the most important one, start small. Consistency always beats intensity. You don't need grueling 30-minute workouts. You don't need a gym membership. You don't even need a perfect, complicated routine. Seriously, just 1 minute a day of a simple neuromuscular reset can begin to shift your entire baseline. Think of these movements like brushing your teeth. It's a small, daily habit that protects you long before any major problems can start. It's proactive care. Second, stop chasing the stretch and start chasing control. So many people try to loosen a tight back by stretching harder and harder. But your spine doesn't need to be aggressively pulled on. It needs to be retrained. Control equals safety for your nervous system, and safety is what allows for healing. When your muscles learn to fire in the correct sequence, pain begins to fade naturally, without any force. Third, rebuild your strength gently, especially in your hips and your core. A lot of back pain actually starts in the hips. Stronger, more mobile hips mean a freer, happier back. A more stable core means you wake up with less stiffness and you move with more confidence throughout your day. And this doesn't take heavy lifting. It just takes thoughtful activation, which I'll show you how to do. Fourth, learn to listen to your body's language. It's talking to you all the time. A sharp, shooting pain is a red light. Stop. A mild stiffness or a gentle ache is a yellow light. That means proceed, but go slowly and with awareness. A feeling of smooth, easy movement. That's your green light. Go for it. Healing really begins the moment we learn to listen to these signals. And finally, my fifth piece of advice is to measure your progress in function, not in numbers. Who cares if you can bend an inch further? What matters is real life. If you can stand a little taller at the grocery store, if you can rotate to check your blind spot in the car a little easier, or if you can get out of your favorite chair with less hesitation, you are winning. You don't need perfection. You just need to be present with your body. And please, remember this, movement isn't punishment for what you ate or for sitting too long. Movement is communication. It's a conversation between your brain and your body. And your body is always, always listening. You're not moving to try and get younger. You're removing so that the future version of you can keep living life on your own terms with freedom, with confidence, and with dignity. Let's be clear about something. Lower back pain is not the end of your strength. In fact, it's often the beginning of your awareness. Your body has spent years faithfully adapting to your habits, your posture, and your routines. Now, it's simply asking for something different. It's not asking for intensity or struggle. It's asking for precision. The 4 neuromuscular reset exercises we're about to do aren't just physical movements. Think of them as conversations between your brain and your spine. They are gentle reminders of how you were designed to move in the first place. Every single time you press up on your elbows, rotate your knees gently from side to side, hover that knee in the bird dog position, or draw a slow, deliberate hip circle. You're sending a powerful message deep into your nervous system. That message is, I'm still here, I'm still capable, and I'm taking back control. Real, lasting healing rarely happens in one big, dramatic moment. It's not a lightning strike. It happens through the accumulation of small, consistent choices. It's the kind of choice you made simply by clicking on this video and deciding to begin. So please, be patient with yourself, be gentle with your body, and most importantly, be proud of every single step you take, no matter how small, toward reclaiming your mobility and your confidence. Your back isn't failing you, it's waiting for you. It's waiting for you to lead it back to a place of balance and strength. And here's the beautiful truth. When you give your body the right signals, it always, always responds. If today's video and these ideas gave you some clarity, or a bit of relief, or even just a little spark of hope, I would be honored if you'd stay connected with our community. Go ahead and click the subscribe button for the healthy path. We regularly post doctor-guided exercises, pain relief routines, and science-based strategies to help you stay strong and active, especially after 50. And I'd love to hear from you. Please leave a comment below. Tell me your name, your age, and which of the 4 movements we did today felt the best for your body. I personally read every single message. And finally, if you know someone you care about who could benefit from this, please share this video with them. Relief grows so much faster when we help each other heal. Your journey back to strength starts right now, and I'm truly honored to walk this path with you.